This is David McCauley from GlobalRPh. Please like and subscribe if you would like to see similar videos in the future. The pharmaceutical landscape is undergoing a seismic shift, with chain pharmacists at the epicenter of a growing crisis. As the healthcare sector evolves, these essential professionals find themselves navigating an increasingly complex web of challenges, chief among them being the pervasive issue of burnout, exacerbated by critical staffing shortages. This comprehensive analysis delves into the multifaceted nature of the problem, exploring its root causes, far-reaching consequences, and potential solutions. In this exploration, we will examine the intricate interplay of factors contributing to pharmacist burnout, from the relentless demands of an aging population to the financial constraints squeezing the industry. We'll analyze the impact of technological advancements, regulatory changes, and shifting patient expectations on the day-to-day realities of pharmacy practice. Moreover, we'll investigate the various initiatives and strategies being implemented to address these challenges, assessing their efficacy and potential for long-term success. The perfect storm: factors fueling pharmacist burnout. The phenomenon of burnout among chain pharmacists is not the result of a single factor, but rather the culmination of numerous pressures converging to create an unsustainable work environment. This perfect storm of challenges has been brewing for years, with recent events serving as catalysts to bring the issue to a critical point. Escalating workload demands. One of the primary drivers of pharmacist burnout is the relentless increase in workload demands. As the population ages and chronic diseases become more prevalent, the volume of prescriptions has surged dramatically. Data from the National Center for Health Statistics reveals a 35% increase in prescription drug use over the past 2 decades, with the average American now taking 4 prescription medications. This uptick in prescription volume has not been met with a proportional increase in staffing or resources. Consequently, pharmacists find themselves racing against the clock to fill prescriptions, counsel patients, and manage inventory, often sacrificing breaks and working extended hours to keep up with demand. Staffing shortages and recruitment challenges. The pharmacy sector is grappling with a significant workforce crisis. A survey conducted by the American Society of Health System Pharmacists found that 89% of pharmacy leaders reported difficulty in filling open positions. This shortage is particularly acute in retail chain pharmacies, where competitive pressures and budget constraints often lead to lean staffing models. The recruitment pipeline is also showing signs of strain. Applications to pharmacy schools have declined by 30% since 2017, according to the American Association of Colleges of Pharmacy. This downward trend in new entrants to the profession threatens to exacerbate the staffing shortage in the coming years, placing even greater pressure on existing pharmacists. Technological advancements and automation. While technological advancements have the potential to streamline pharmacy operations, they have also introduced new challenges. The implementation of electronic health records, or EHRs, and automated dispensing systems requires pharmacists to adapt to new workflows and acquire additional skills. A study published in the Journal of the American Pharmacists Association found that 67% of pharmacists reported increased stress levels associated with technology adoption. Moreover, the promise of automation to reduce workload has not fully materialized in many settings. Instead, pharmacists often find themselves managing complex systems while still performing traditional tasks, effectively increasing their responsibilities without a corresponding reduction in other duties. Expanding scope of practice. The role of pharmacists has expanded significantly in recent years, with many states granting them authority to provide immunizations, perform point-of-care testing, and even prescribe certain medications. While these expanded responsibilities can enhance patient care and professional satisfaction, they also add to the workload of already stretched pharmacists. A survey by the American Pharmacists Association found that 72% of pharmacists reported an increase in clinical services provided over the past year. This expansion of duties, while professionally rewarding, often occurs without a corresponding increase in support staff or adjustment to workflow, further contributing to burnout. Regulatory compliance and documentation burdens. The pharmacy profession is heavily regulated, with stringent requirements for documentation, quality assurance, and compliance with state and federal laws. These regulatory demands, while necessary for patient safety, add a significant administrative burden to pharmacists' daily responsibilities. A study published in the American Journal of Health System Pharmacy estimated that pharmacists spend up to 25% of their time on administrative tasks related to regulatory compliance. This time spent on paperwork and documentation detracts from direct patient care activities and contributes to feelings of frustration and burnout among pharmacists. The human cost impact on pharmacists and patient care. The repercussions of burnout among chain pharmacists extend far beyond the individual professionals experiencing it. The consequences ripple through the entire healthcare system, affecting patient care, medication safety, and the overall quality of pharmacy services. Understanding these impacts is crucial for developing effective interventions and safeguarding public health. Deteriorating mental health and well-being. The toll of chronic stress and burnout on pharmacists' mental health is significant. A comprehensive study published in the Journal of the American Pharmacists Association found that 61.2% of pharmacists reported experiencing high levels of burnout, with 45.3% screening positive for depression. These alarming statistics highlight the personal suffering endured by many in the profession. Symptoms of burnout among pharmacists often include emotional exhaustion and cynicism, decreased job satisfaction and engagement, increased risk of anxiety and depression, physical health problems, including insomnia and cardiovascular issues, and even substance abuse as a coping mechanism. The long-term consequences of these mental health challenges can be severe, leading to decreased quality of life, strained personal relationships, and in some cases, leaving the profession altogether. One of the most concerning aspects of pharmacist burnout is its potential impact on patient safety. Fatigued and overwhelmed pharmacists are more prone to making errors in medication dispensing and counseling. A study in the American Journal of Health System Pharmacy found a direct correlation between pharmacist workload and the likelihood of medication errors, with error rates increasing by 3% for every additional prescription filled per pharmacist hour. Common types of medication errors associated with high workload and burnout include incorrect drug or dosage dispensed, failure to identify drug interactions or contraindications, inadequate patient counseling on medication use and side effects, and overlooking potential allergic reactions. These errors can have serious consequences for patients, ranging from treatment ineffectiveness to severe adverse reactions and hospitalizations. Pharmacists play a crucial role in patient education and medication management. However, when faced with overwhelming workloads and time pressures, the quality of patient interactions often suffers. A survey by the National Association of Chain Drug Stores found that 78% of pharmacists reported having less time for patient counseling compared to 5 years ago. The impact on patient care manifests in several ways. Shorter and less comprehensive medication counseling sessions, decreased availability for answering patient questions and addressing concerns, reduced time for medication therapy management and chronic disease monitoring, and limited capacity to provide preventive health services and immunizations. This reduction in patient engagement can lead to decreased medication adherence, poorer health outcomes, and increased healthcare costs due to preventable complications. Burnout is a significant driver of job dissatisfaction and turnover in the pharmacy profession. A study in the American Journal of Pharmaceutical Education reported that 32% of pharmacists were considering leaving their current position due to stress and burnout. This high turnover rate has several negative consequences: loss of experienced professionals from the workforce, increased costs for pharmacies in recruitment and training, disruption of continuity of care for patients, and added stress on remaining staff members who must cover vacant positions. The cycle of turnover and understaffing perpetuates the conditions that lead to burnout, creating a self-reinforcing problem that is difficult to break without systemic interventions. Ethical dilemmas and moral distress. Pharmacists often face ethical challenges in their daily practice, such as balancing business pressures with patient care needs, or navigating conflicts between prescriber instructions and best practices. Burnout can exacerbate these ethical dilemmas, leading to moral distress when pharmacists feel unable to provide the level of care they believe is necessary. Examples of ethical challenges faced by burned-out pharmacists include pressure to meet prescription quotas at the expense of patient counseling, difficulty in addressing suspected prescription drug abuse, conflicts between corporate policies and professional judgment, and inadequate time to properly review patient histories and potential drug interactions. These ethical pressures can lead to a sense of compromised professional integrity, further contributing to job dissatisfaction and burnout. Public health implications. The impact of pharmacist burnout extends beyond individual patient interactions to broader public health concerns. Pharmacies play a critical role in community health initiatives, including vaccination programs, chronic disease management, health screenings and early detection of conditions, medication adherence support, and public health education and outreach. When pharmacists are overwhelmed and understaffed, their capacity to engage in these important public health functions is diminished. This can lead to gaps in preventive care, reduced community access to health services, and potentially increased burden on other parts of the healthcare system. As we consider the far-reaching consequences of pharmacist burnout, it becomes clear that addressing this issue is not just a matter of professional well-being, but a critical public health imperative. In the following sections, we will explore strategies and interventions aimed at mitigating burnout and creating a more sustainable work environment for chain pharmacists. Strategies for mitigation. Addressing the burnout crisis. Recognizing the severity of the burnout crisis among chain pharmacists, stakeholders across the healthcare industry are implementing various strategies to address the issue. These interventions range from organizational changes to technological solutions and policy reforms. While no single approach can completely resolve the complex challenges facing pharmacists, a combination of targeted efforts shows promise in alleviating some of the pressures contributing to burnout. Policy and regulatory reform. Addressing burnout also requires changes at the policy level to create a more supportive practice environment. Some states are considering legislation to establish maximum prescription volumes per pharmacist shift to ensure safe practice conditions. Allowing pharmacy technicians to take on more responsibilities can help distribute workload more effectively. Advocating for fair compensation for clinical services provided by pharmacists to reduce financial pressures on pharmacies is also crucial. A pilot program in Oregon that implemented workload limits and expanded technician roles reported a 28% decrease in medication errors and a 33% increase in pharmacist job satisfaction. The road ahead, envisioning a sustainable future for pharmacy practice. As the pharmacy profession grapples with the challenges of burnout and staffing shortages, it's crucial to look beyond immediate solutions and consider the long-term trajectory of the field. By reimagining the role of pharmacists in healthcare and addressing systemic issues, we can work towards a more sustainable and fulfilling future for pharmacy practice. Evolving roles and expanded scope of practice. The future of pharmacy lies in fully leveraging the expertise of pharmacists as healthcare providers, provider status recognition, advocating for federal legislation to recognize pharmacists as healthcare providers under Medicare, enabling broader service offerings and improved reimbursement, specialized clinical roles, developing new positions for pharmacists in areas such as pharmacogenomics, precision medicine, and chronic disease management. Public health leadership, positioning pharmacists as key players in community health initiatives, disaster response, and health policy development. A projection by the American Society of Health System Pharmacists suggests that by 2030, 50% of pharmacists could be working in advanced practice roles that extend beyond traditional dispensing duties. Reimagining pharmacy, design and workflow. The physical layout and operational flow of pharmacies can be optimized to support new practice models, patient-centered design, creating spaces that facilitate private consultations and clinical services, modular workstations, flexible workspace configurations that can adapt to changing needs and services, virtual pharmacy services, developing infrastructure for remote medication management and telehealth consultations. A pilot study of redesigned pharmacy spaces reported a 35% increase in patient engagement time and a 28% improvement in pharmacist job satisfaction. Addressing social determinants of health, pharmacists are uniquely positioned to address health disparities and social factors affecting patient outcomes, community health needs assessments, conducting regular evaluations to identify and address local health priorities, partnerships with social services, collaborating with community organizations to provide holistic care and support, cultural competency initiatives, developing programs to better serve diverse patient populations and address health inequities. The National Association of Chain Drug Stores Foundation projects that by 2025, 75% of chain pharmacies will have formal programs addressing social determinants of health in their communities. In conclusion, the journey to mitigate burnout among chain pharmacists and create a sustainable future for the profession is complex and multifaceted. It requires a concerted effort from individual pharmacists, pharmacy chains, educational institutions, policymakers, and healthcare partners. By addressing the root causes of burnout, implementing targeted interventions, and reimagining the role of pharmacists in healthcare, we can work towards a future where pharmacists are empowered to practice at the top of their license, contribute meaningfully to patient care, and find personal and professional fulfillment in their work. The challenges facing pharmacy practice are significant, but so too are the opportunities for positive change. As we move forward, it's essential to maintain a focus on the core values of the profession: patient care, safety, and health promotion, while adapting to the evolving healthcare landscape. With continued advocacy, innovation, and commitment to professional well-being, the pharmacy profession can overcome the current crisis and emerge stronger, more resilient, and better equipped to meet the healthcare needs of the future. Please like and subscribe if you enjoyed this video. I am Dr. David McCauley, and I started the GlobalRPh website over 20 years ago. This newly created channel starts a new chapter. Thank you for watching.